Good afternoon, everyone. So today, on behalf of the Health Economics Unit, presenting today is Gaironeesa Hendricks. She is a postdoctoral fellow between Health Economics Unit, myself, and Dr. Janetta Habron in the Division of Human Nutrition. She's working on the Co-Create project, and she's presenting a part of the project. Thank you very much. On the floor, Gaironeesa. Thank you.
Thanks so much. Thank you so much for the introduction, Funke. So as Funke mentioned, my name is Gaironeesa Hendricks. I'm just going to be putting off my video because I may freeze as we go about. But can everyone hear me? Okay, great. Thanks. So today I'll be speaking about adolescents' perspectives on the drivers of obesity using a group model building approach. And this study forms part of the Co-Create project that Funke just mentioned earlier, but I'll speak a little bit about the study later on. So just to provide a brief background regarding the study. So about 2 billion individuals worldwide are overweight and obese, and about 62% of the world's obese population resides in developing countries. So in South Africa, for example, adolescents between the ages of 15 and 19 years, about 27% of females and about 9% of males are overweight and obese. Right, so there are a number of risk factors that influences overweight and obesity. So these include, for example, behavioral factors such as, for example, time spent using electronic devices, so increasing in meal frequencies, low physical activity have been associated with overweight and obesity. But there's also additional stresses that may impact overweight and obesity, and these include psychosocial stresses such as, for example, residing or living in an adverse family environment, or even coming from or even an adverse peer context within the school environment, for example, which has been associated with overweight and obesity. But there's also larger factors such as, for example, global trade liberalization that may impact changes in diets and lifestyle, and in turn overweight and obesity. So while there've been a lot of studies that explored these risk factors, there've been less studies that focuses on using a group model building approach. So our colleagues from Europe, in the UK, for example, Natalie Savona et al., they particularly looked at these drivers of obesity in the context, and so what they found was this framework brought new insights into understanding complex systems that sort of drive obesity, overweight and obesity. So as mentioned, there's biological, physiological, psychosocial risk factors, risk factor profiles, but these profiles may differ in low to middle income countries in comparison to the developed countries or the developed world. So much remain unknown about these factors or the interactions between these factors, especially within a low to middle income context. So the aim of the study was to explore adolescents' perceptions of the determinants of obesity in 4 South African schools using a group model building approach as part of the Co-Create project. And so the Co-Create project is a multi-setting, multi-strategy project that aims to really look at reducing the prevalence of obesity, but also looking at policy actions that may promote healthier food environments and healthier physical activity environments. So early on, I mentioned that some of our colleagues did the same or similar study, but they looked at particularly 5 European countries, and the sample was much bigger than our sample. But what they found was, using this group model building approach, they found that commercial drivers of unhealthy diet, social media use, body image were particularly drivers associated with obesity. So this study was qualitative in nature. It used a community participatory approach. And the aim was to generate system maps in the form of causal loop diagrams. So so causal loop diagrams is just another term used for maps. So the inclusion criteria, so we particularly were interested in looking at 16 to 18-year-olds, or including 16 to 18-year-olds. They need to be registered in a school, and they needed to be competent in either giving assent or consent. And then the exclusion criteria is, of course, not fulfilling the age and the requirements of the inclusion criteria. So the sample was selected. So we used purpose of sampling to select the schools in Cape Town and in the surrounding areas. So we selected 2 middle to high socioeconomic status schools and 2 low SES schools. And that's just the sample sizes for each school. So for example, for school 1 had 7 adolescents, school 2, 15, school 3, 18, and school 4, 22. So our sample, our total sample came to about 62 adolescents. Okay, and so the way in which we went about doing this was, the adolescents, they needed to participate within these sessions or workshops. We needed to have an average of 10 to 15 adolescents per group. So we had a total of 62 adolescents from 4 schools. We had 2 trained facilitators per workshop, and each workshop occurred for about 90 minutes. And the workshops were designed to keep participants engaged within generating diagrams, pictures, graphs, to kind of present these qualitative representations of what they thought were the determinants of obesity. The facilitators encouraged participants to make links between the different variables to generate a causal loop diagram or map, which I'll show to you guys later. But so this causal loop diagram had different causal relationships and connections between variables. So it had positive relationships and negative relationships. And within this map or causal loop diagram, we had different feedback loops, which I'll chat about later. So part of this process was note-taking. And note-taking occurred during each session and after sessions. So one facilitator took notes, and then also the purpose of the note-taking was to re-engage these maps, to compare the diagrams with the original notes, to ensure that the map reflects discussions that actually took place. So a software called Sticky was used, developed by Deakin University, to generate these causal loop diagrams or maps. So the research team was responsible for generating the map in Sticky, and there was continuous note-taking occurred, which resulted in a final map for each school, right? So because we had 4 schools, we sat with 4 maps. However, these maps, part of this process, according to Allen et al., these maps needed to be merged into one map. And so the way in which we did this was each causal loop diagram or map was edited to either remove variables that had connections either going in or connections either going out. But each map was probed, checked, and modified. So what we did was we chose a base map out of the 4 maps that contained the most remaining variables, right? So we decided to either include or exclude variables, but we discarded variables. The discarded variables were placed on the side of the map for further exploration. So this final base map was further explored by the team to ensure that the links between within the causal loop diagram were accurately presented. That we checked that no variables had been unnecessarily removed or repeatedly verified. So because we had these 4 maps, right, and going through this process, we sat with one final map or master map, which was also further refined. And this is basically what the final map looked like. So you'll see the final map, and then within this map, there's sort of different loops. And within this, the main kind of feedback loops that came out were considered the dominant themes within this map. Right, so basically, what we found was okay, I thought somebody's asking something, but so just in terms of the results, so four main themes or feedback loops emerged out of this main or final map, and these included outdoor environment, social media use, and physical activity. So that was one theme. The second theme was easy accessibility of unhealthy food and energy intake, or increase energy intake or body weight. The third theme spoke around psychological distress, weight-related bullying, and pressure on a particular body image. And the fourth theme spoke to parental neglect and unhealthy food intake. Right. So what I'll do now is I'll just sort of discuss these themes into more detail. But basically, the first theme spoke to outdoor environment, social media use, and physical activity. So within this theme, what the adolescents mentioned was that safety was particularly an issue that came out. So they felt very unsafe within the communities, and this would impact the levels of physical activity. And this would then have an impact on their interest or motivation to exercise. So they would feel less interested or less motivated to exercise. They would prefer staying indoors. And when they did stay indoors, what they said was that they used more technology, or there was increased use of technology and more use of social media. Right? But part of this theme was that they also mentioned that because they stayed indoors, there was the possibility of them of increased or higher body weight. And this in turn, they said was mainly to weight-related diseases and would increase health costs. But what they also mentioned was that within these low and middle income communities, or mainly low income communities, there's been a lack of available school programs or community programs, lack of accessibility to these programs, and that would have an impact on the physical activity. Sorry guys. Okay, so they said, so basically this is basically what I said: exposure to community violence increased the use of social media and high crime rates impacted the interest and motivation to exercise, and they preferred staying indoors. So they would say, crime is very bad. You're putting yourself in danger. People can attack you. They feel stressed to go and run. So this would lead to increased use of technology. And then, of course, with the increased use of technology, there's an increased exposure of advertisements of unhealthy food. And there's also the easy accessibility to this unhealthy foods. For example, Uber Eats. They'll have access to Uber Eats and other means of accessing these foods. And they also said, as I've mentioned, limited available exercise programs, especially within low-income communities. And of those, what they also mentioned, of those exercise programs that's available within these communities, it's also fine distance. A lack of exercise programs in this region. There's only one, and it might be difficult to get there because some people live far. Scheduling is also a problem. Distance to travel takes time. Right. So they said that low levels of physical activity contribute to high body weight and the risk of weight-related diseases. And then increase in unhealthy food resulted in weight gain, and it may influence, and it's influenced by the easy accessibility of unhealthy foods within the communities. Right. So there's another feedback loop. So the second thing was this easy accessibility of unhealthy food and energy intake, increasing energy intake and body weight, right? So basically what they meant here was that because of the easy accessibility and the easy availability of unhealthy food within the communities, this may impact the unhealthy food intake. So they said, for example, unhealthy food intake is cheaper than healthy food, so it can feed everyone. So despite the fact that there's easy accessibility, they also thought that, or felt that they have access to this unhealthy food, and they can also feed larger families. This can also feed larger families. And they also mentioned that they have usually access to pocket money. So the parents would be, caregivers would give them pocket money, and this would just make it easy to purchase unhealthy food because they have easy access to tuck shops, spaza shops or takeout outlets, and they can buy things like, they sell things like chips. Children will use all their pocket money on chips to get full when they don't get food in school, which is unhealthy. It's basically what an adolescent said. Unhealthy food is cheaper than healthy foods, and it also costs less, especially for large families. And an adolescent said that these chips that they sell is cheap. We live in developing town, we'll buy food we can afford. Okay. Another quote from another adolescent: their school doesn't cater for healthy food. They sell things like chips. Children will use all their pocket money on chips to get full when they don't get food into school, which is unhealthy and can lead to weight gain. Children are still developing, so they pick up or lose weight faster depending on what they eat. The cost of unhealthy food is more affordable than healthy foods. If a tuck shop sells healthier things, then children's weight will also decrease. So this regular consumption of unhealthy food also brought sort of negative feelings about their body weight, and also them at the end feeling or having a negative perceptions of their body image and shape, which brings about another feedback loop and speaks about really kind of the mental health aspect. Where they refer to psychological distress, weight-related bullying, and the pressure of having a particular body image as another dominant theme coming out of the map. Yeah, so this theme basically speaks about stress and how stressed out they feel in terms of home, the home environment, academic pressure, or school environment, and how that sort of impacts the unhealthy food intake and then and body weight. So they mentioned that a number of stresses, so home stresses, school stresses, that contribute to unhealthy food intake, but also disordered eating, and particularly eating comfort foods. So stress can be academic stress, it can be relationship stress with girlfriend, boyfriend, financial stress, increased stress results in increased eating. So this increased energy intake results in weight gain, and as a result, unhealthy food intake. And in addition to that, so even though they're experiencing these stresses, within the community, body weight is also stigmatized, and it places additional pressure on themselves for having a particular body image and shape. And this cycle of excessive eating can result in weight gain and sometimes even weight-related bullying. What they also mentioned was that Differences in body image and shape are attributed to differences in rural and urban settings. And this also adds to additional stress. And Adolescent mentioned that in African culture, especially girls, people will assess you because they haven't seen you the whole year. If you've lost weight, they'll tell you that you won't get married, so you'll eat more over the holidays to try to meet those expectations. There is a cultural preference for a curvy, rounder figure. The pressure from society have fuller figures in the Eastern Cape, but not when you get back to Cape Town and when you're back on social media. So they also based on this, they mentioned that they experience sort of this contradiction of having a certain body image when they go back to the Eastern Cape, but when they're back in the urban setting or in Cape Town, there's a different expectation, and that adds to additional stress. So this results in pressure on having a particular body image, and also results in having a poor self-esteem or low confidence levels. The fourth theme speaks to parental neglect and an unhealthy food intake. So with this theme, they mentioned that as a result, they feel neglected by parents, and as a result, they seek sort of attention elsewhere. And this results in increasing unhealthy food intake or overeating, and then increasing body weight. What I said was parental neglect, so the failing to respond to the parents fail to respond to the emotional needs, and this results in seeking attention and affection elsewhere. So an adolescent mentioned that our parents no longer care what we eat, they just give us money. When we get home from school, our parents get home late, or we get home late, and we end up eating things like 2-minute noodles, and we don't eat with our families anymore. So this results in, more time spending or increasing time with friends or peers, and with that, they would more likely consume alcohol, and they would eat more comfort foods. What they also said was parental neglect also had an impact on teenage pregnancies, and of those that use, for example, contraceptives, that was also associated with weight gain. In addition to that, they also spoke about domestic discord and violence, which is common within their homes. And because there's sort of violence within their homes, it could be physical, emotional abuse, for example, they are also forced to raise their younger siblings. So in the olden days, people used to live in warm, loving homes. Now they are abused by their parents, or their parents are fighting, or they're taking care of their small brothers and sisters at home. Home, which is stressful, which leads to overeating. So you eat more and you drink alcohol, too much food intake. Yeah, so that was the fourth theme. So just to provide a discussion in terms of the study, so this is a novel study. It's the first to explore the perceived determinants, so the adolescents' perceptions of what they thought were the determinants of obesity, using a qualitative approach, but using a systems approach in a low to middle income country. Studies using systems mapping examines obesity have been done with adults, but less of this type of work have been done with children and adolescents. So this data is consistent with prior data and individual studies that focuses on, for example, outdoor safety and physical activity, the use of technology, mental health that impacts eating patterns, parental neglect. However, our study extends its work by examining feedback loops involving these factors, the interrelationships between these factors, and which is important for public health policies and particularly targets for intervention. So just in terms of the limitations of the study, so it's a qualitative study, but it's not, of course, not fully representative of the general population. The details of these individual characteristics were not recorded, so participants were not screened for having, for example, an eating disorder. yeah, so just in terms of my final thoughts, so this study provided an indication of what the participants' views are on the drivers of overweight and obesity, but it situated this within a system. And what we plan to do now is, so the next steps within this project is using this map that this finalized map that we have. We are intending to work with youth, and we'll call them youth alliances, to kind of examine these loops and for them now to determine policy actions within this map. And then this will be followed with having dialogue forums with adolescents to identify sort of the feasibility of these policy ideas that they've identified, but have discussions with stakeholders and with other policymakers. And then also to use a systems modeling approach at the end to model the effect of these policies on obesity trends. So that's basically the plan that we have for the next phases of the project. Yeah, and that's about it.
Thank you so much, Gaironeesa. I really appreciate that. So the floor is open for questions, comments. We're still writing up the paper, so we would appreciate comments and recommendations on how to do it. So please feel free to jump in. I really can't see my hands or anything here. Simpiwe, please, do you have access to seeing show of hands? Okay. All right. I see. I can see. Lucia, please go ahead.
Hi, thank you very much for the very interesting presentation. I thought it was great, and group model building is an interesting method. I was just wondering whether you feel like your results and the kind of themes are different because of the method that you used, or do you think that you would have kind of similar results if you'd just done a standard focus group discussion? And obviously I'm asking you it's a hypothetical question, but I'm just interested in terms of your reflections on the process. Thank you.
Thanks, Lucia. I think, I think we could have similar or different results, but the way in which the activities that we used and the actual method, the group model building sessions and activities and all of those kind of things, presented sort of a more in detail kind of discussion with regards to the drivers of obesity. So it was really for us to go, back and forth, working with the adolescents, asking them if they're sure these were the factors. Note-taking, for example, is an additional method to kind of determine what they thought were these factors. But I don't know. I think the process is very different to your normal focus group discussion, because that would mean that you'd identify, your themes straight on. But I think the group model building session provides a more kind of structured approach in determining sort of these factors.
Thanks. The other aspect is that both of them have their advantages and disadvantages, but this kind of model and method allows the adolescents to actually create their themes and have in-depth discussion and in-depth engagement, co-creating the different themes. And actually also they were empowered and trained to create their mapping. So they themselves were able to connect the dots as much as possible. So we just facilitated, but they were able to create their dots and link up the dots by themselves. So it was very, very co-created with the adolescents. Does that help?
Yes, absolutely. I think that's great. And I think it would be useful to reflect on some of that co-creation and process in the paper that you're writing, because I think that's very interesting and relevant in terms of how you come up with those things. Can I sneakily ask another question, Funke?
Okay.
I wanted to know if you used the sticky process during the sessions, or whether that was something that you did afterwards based on kind of paper-based maps that you had created in the sessions.
Gaironeesa, would you?
I think it was afterwards.
It was
I wasn't
afterwards.
directly involved in that.
Yeah.
It was afterwards when they inserted it within the online platform or digital platform.
Because the project happened before COVID, so we were there physically first, and then before we used everything within that training time. Melanie?
Yeah, no, I actually was just going to ask about that, because doing the CLDs is so dependent on very robust and intense interaction and dialogue and so on. So clearly, if it was before COVID, because I would imagine it would be quite a struggle to do it virtually. But so I think the thing that strikes me, Funky, and it's how do so Gaironeesa, thank you so much for what was a really, really wonderful presentation. And so we use some of the tools in one of the PGDIP programs that we do, but not in the same kind of detail that Gaironeesa described. And I think it's a really interesting set of tools, using systems thinking tools to make sense of very complex issues and complex situations. So I'm quite excited to see how, what had emerged out of this process. And I think it's maybe a methodology that we should think of using a bit more when we're trying to unpack really complex, layered issues such as the issue of adolescent obesity is. So I was just wondering, in the work that you are doing, and Funke, I mean, that we are also working on similar-ish kind of work through another project. So I think we do need to find ways of connecting our work, but so much in what you've highlighted, Gaironeesa, and it's also what we do find, even though we are so aware of the structural determinants that influence, behaviors and choices around food and diet, that much of those choices are not free choice, if you know what I'm saying. And so I'm just wondering, from the work that you are doing, how you are marrying what appears to be a number of factors that still is positioned very much at the individual behavior level. How are you, in your thinking, marrying it with the need to really intervene at a structural determinant level? Because we speak about big food and so forth and so on, but then when we do the work that we do, we illuminate mainly around individual behaviors and individual choices. So how are you guys in your particular project marrying the two groups of influencing factors, individual versus structural, or individual and structural, shall I rather say?
Okay, go on, Gaironeesa.
I'm not sure how to answer that, but yeah, it's a difficult one because, you know, you have these factors on the individual level, and then you have these broader factors, which is a lot of the times, you know, out of, you know, the out of the adolescent's control, or yeah, it's just harder to kind of to manage or to access. So yeah, I think with sort of the work that we plan to do is to kind of further explore policy actions and how we can implement possibly, you know, what they are identifying. So, for example, they may identify something, a probable need could be unhealthy food at tuck shops, right? So even though the individual have access to the tuck shop and to the unhealthy food, it's something that can, you know, can be possibly be worked on, or policies around that could be implemented. So yeah, so I'm just thinking, so the individual have access to it, but it's also kind of a bigger factor that can be where policies can be kind of focused on or implemented at.
Thank you, Gaironeesa.
Thank
Melly.
you. Yeah.
That question actually relates to the next step, where we are trying to train adolescents on advocacy, and they are supposed to co-create with us actionable policies in relation to these factors that have been identified. So that's the next step to the project, is to actually work among adolescent groups to come up with, to be advocates of the solution, to create to have a solution to the problem they've observed, and actually be advocacies to this solution. So they're supposed to be like youth alliances that will look at the problem, try to come up with actionable policies, and engage with policymakers wherever, kind of have policymakers coming in and engaging with the youth, and see how they can actually come up with actionable policies and be strengthened and empowered to make a change.
Thanks so much. And I'm really just asking because it's not an easy transition to make. Not that I'm kind of feeling that you have to have
Yeah.
an answer. It's kind of how do we together pool resources in order to get to where we'd like to go? And so I'm just wondering if it's worthwhile engaging with the Children's Commissioner office in the Western Cape, because we have a Children's Commissioner now, and she's she's in a very, very powerful position where she's able to enter into different policy spaces very, very easily, I think. And she works with a group of young people of all ages to take on many different advocacy causes, and to actually, I think, combine forces, if you want to, or to work with her in addressing what is a very serious, I think, sort of violation of health rights of adolescents, the obesogenic environments that we are creating. So suggestion is that maybe we should approach the Children's Commission and see if she would be willing to take this on head on as an advocacy cause from her office, and provide that sort of really high level political platform that it deserves, I think.
Definitely.
Thanks so much, Melin. That would
very
definitely help. Yeah.
Yeah, because the problem actually is the fact that the obesogenic environment is really toxic for the adolescents. And it's not only in terms of their weight, it's also in terms of their psychosocial, their mental health. So it's way beyond the weight itself, but it's also on their mental health. And yeah, that's something we could work on. And mainly, I would take you up on that.
Yeah.
That'd be great.
Sure.
Thanks.
Any other question? Comments? Okay, can't find any hands. So, what the other question I would like to ask, just a bit of clarity for everyone, is Gaironeesa, in your maps, there is the broken line and the solid line. So, what is actually the difference? Just for people, for clarity.
Oh, so do you want me to share this my screen again quickly to show you guys?
Okay. And probably the colors also.
Yeah, so basically each color meant a particular kind of theme, or so for example, like the purple was mental health related, the yellow was related to eating, but basically what Funke just asked about the arrows, so you had the dotted arrows and then solid lines or solid arrows, and so the solid line indicated a positive relationship between the variables. So as the one variable increased, the other increased, and then of course with the dotted line had indicated sort of a negative relationship. So as the one increased, the other decreased. But yeah, so these themes that came out, so these things came out of the main map. And go back to the main map. Yeah. So this is just the main map with all the themes and the different arrows. And initially, as I've mentioned, we started off with the 4 maps from each school, and then kind of merged those 4 maps into this one map. There were similar variables or concepts that came out across the schools, but there were also different variables. And we're also thinking of, hopefully, to perhaps do a comparative study across the 4 schools, because some schools, for example, mentioned mental health was a big thing, and then in another school maybe it wasn't as of a big component. But in the future, for us to maybe write a paper to compare these different schools and the different variables that's coming out in comparison to this paper that actually looks at kind of the larger determinants of across all 4 schools. Yeah. So it was a very interesting activity, lots of engaging in the variables, making sure and ensuring that these were actually what the adolescents were saying in terms of what they thought were the determinants, and yeah, lots of back and forth and kind of decisions around that.
Thank you, Gaironeesa. The interesting aspect also is the fact that there are negative relationship and positive relationships. So it's not only the circular in terms of the systems mapping, but the fact also that there's some relationship that is actually negative and that has adverse effects, and there's some that have positive effects. So maybe that's also something that we have to look into to see where the direction of relationship is going and what we can emphasize in terms of policy.
Yeah.
Thank you so much. I can see any hand comment. I can see any hands, no comments. Okay. So thank you so much, Gaironeesa, for presenting today. And thank you everyone for coming on board. And thank you for being part of this presentation today. And I wish everybody happy Heritage Day and a lovely weekend, long weekend. Thank you so much.
Thanks, everyone. Bye.
Thank you.